Assalamu alaikum and hello to everyone here. I know it's very rare that I come up and have sessions and discuss things, and the reason is because I'm very busy. So you have to bear with the fact that I'll be announcing a session like probably 3-4 hours before when I know where things are going. Otherwise, it's very, very difficult for me to find out time and to get in touch with all of you. So lately, I've been seeing that a lot of people struggle with good introductions. What I mean by good introductions is that, let's be very critical and let's be very realistic when it comes to the exam. You have 32 candidates every day, and the examiner listens to all the 32 candidates each day, which the number, by the way, is increasing gradually. They're going to take it to an 80 and then a 96. So 4 or 5 sessions a day, 6 sessions a day. And he's constantly listening. Do you really think he does justice to 8 minutes? No, I don't think it is technically possible that someone does justice to 8 minutes and constantly makes sure you did the DDs, you did the diagnosis, you engaged with the patient, or you addressed or you managed the patient rightly, you said the right things, or you didn't know. So what's the easiest way? If we had to summarize, what are the things that the examiner is looking at, and what are the things that he's really paying attention towards? Two things that make a very big difference in the exam is the first, your first minute, your introduction, the way you're going into the case, how do you introduce yourself, and what sort of a rapport are you building with the patient? And the second most important thing is when the 2-minute bell rings, what are you doing at that time? Are you still stuck in data gathering? Have you entered the management section? And if you have entered the management section, what are you talking about? Are you talking about the 7 steps of management, or are you actually addressing the concerns of the patient? So if I had to make it more brief and more self-explanatory, your introduction, the first minute has to be spotless. Without a doubt, you cannot afford to mess it up or start it with the basic lines that every second person is using. And in the same way, you cannot lose your management by not addressing the concerns at the 2-minute bell. So let's focus first on the first part. The first part is the introduction section. The management, probably we leave it to some other day, but the introduction section is very important. And what I mean by introduction is most of the doctors, when it's written outside, this person has some concerns, Lucy has some concerns, she's here to talk to you. Peter has some concerns, he's here to talk to you. Fine, concerns make sense, but how do you find a creative way to process it and to tell the patient that I know about you, I am here for you, and I am going to help you in any capacity possible? How you do that is by making a good repetition and telling the patient that I have an idea what you're here for, or whatever is unusual, you connect the dots. For example, usually when people go to the exam, I might show one of the junior doctors, can you confirm your name? Can you confirm your age for me? How can I help you? How can I help you is the first line. How may I help you is the first line. What brings you in today is the first line. And that is what everyone is saying. And then the patient starts telling you the story. So what you need to do is that when you're given a task in the exam, you need to paraphrase the task, the mutual information between you and the patient when you're going into the cubicle. What I mean by mutual information is that whatever the patient knows and whatever you know, so you talk about it. The fact that the task outside sheds light on what's going on with the patient or hints towards a particular thing is for you to talk about inside. So when you read the task, it's not like someone says outside, Andrew has chest pain and he has come to the GP out of hours, and you completely ignore the chest pain, you completely ignore the out of hours thing, and you go inside and say, how can I help you? What brings you in today? No, that is probably, the task is probably the nurse told you, the outpatient department clerk told you, the staff informed you of the patient, the admission staff informed you of the patient, and this is your information about the patient. So do not turn a blind eye towards that. Am I making sense so far? I want you guys to throw your questions in the chat section so that I have an idea if like you guys are understanding me or am I just talking to myself? Okay, cool. So again, now how do you change the whole thing? We have a case, Andrew, 65. He's come in with chest pain out of hours to the GP. What makes you different is you're standing outside for the 1 minute and you're building a good rapport. How do I go and I tell this patient that I'm here for you, and I make sure he's comfortable and he feels at home when he's talking to me, he feels at ease. So you go inside. I might show one of the junior doctors here. Can you confirm that you're Andrew and your age? That's brilliant. Thank you so much, Andrew. I read from your notes that you have a severe chest pain and you've come like at this time. Is everything all right with you? Are you comfortable at the moment? You are? Oh, that's fine. So what exactly happened? That's how you start flowing through the case, and he tells you this happened, that happened, this. So you're a different person when you introduce yourself in this way, or when you tell the patient that I read about you, that you have come in with chest pain. Are you comfortable? I read about you that you have this problem. Is it right now? So when you do that, it tells the examiner that this person is an exceptional case. He's not just here to, read the script lines, how can I help you? Because every script starts with how can I help you? What brings you in today? No, this person has gotten out of the scripts. This person is natural and he's really looking into the case. He's not just blubbing and bluffing here and there, right? Then again, another case, you have a case that Samantha is here for her 10 days old baby Adam. Adam has, you have no idea what Adam has. She's here for Adam, the GP surgery. Now, again, the people who are not going to be aware of the fact that introduction has to be spotless, they will tell her, are you Samantha? What's the name of your child? What's the age of your child? How can I help you? That's it. But when someone goes inside and they know what the importance of introduction, they'll say, I'm Aisha, one of the junior doctors here. Are you Sam? Right, Sam. Can you confirm your son's age? Oh, he's just 10 days old. Oh, he must be so cute. Congratulations on his birth. You must be so excited. How are you holding motherhood now? Is that, do you need any sort of support? Have you been sleeping well? Oh, that's good to hear. So, how can I help you today? Now, that's a complete different way of talking to a woman. You are acknowledging the fact that I know you're 10 days postpartum. I know you're in a lot of stress. And I know that your baby's just born. You're telling her all of these things with this sort of introduction. And you're also doing her psychosocial at the same time. So that really makes you stand out from other people. Let's take the suicide case. Lucy has come in. She's 18 years old. She has slit her wrist and she's taken some pills. That's the history that you know. Medical team has informed you. You go inside, not pretending like, how can I help you? No, you can't tell someone who's committed suicide that, how can I help you? You're here to provide help. You're here to provide comfort. You're here to dig in into what they're actually feeling. So you go inside, you introduce yourself, and you keep a low tone because keep it real. Someone who has just committed suicide is not in a mood for an energetic entry of yours. They're not in a mood to see a doctor who's like, hey, I'm this, I'm that, I'm going to do this, and I'm going to do that. No, go like a normal human being inside the cubicle. I am Aisha, one of the junior doctors here on team. Um, I read about you and I'm already very sorry about whatever has happened. And I'm pretty sure you must have had reasons why you did everything, but I'm here to help you. So, is it all right? You comfortable for us to talk? Yeah, check the patient's willingness to talk to you. Check the patient's readiness if they're ready to engage in a conversation. You can't just start with, I am Aisha, how can I help you, with a person who has committed suicide. No, paraphrase the mutual information. Don't pretend like you don't know and I'm here. No, tell them that I know, but I also know at the same point that you might have something that made sense at that time when you did all of these things. Because that is the time when you have your examiner's 100% attention. in the introduction section. And if you mess that up and it goes baseline, you've lost it. You've gotten into the average category of everyone, unless you stand out in the management section then. So if you really want to stand out, you will have to be different from the rest of the people. I'm going to go through a few cases here. I decided we'll go through ethics and we'll go through maybe the statements of the new scripts a little bit, so you guys get an idea of how to build your own introduction. And it doesn't have to be the one that I'm giving you. You guys, everyone can make their own introduction specific to them. And that has to come from the creative side of your brain. That has to be your interpersonal skills and your communication skills kicking. And it's not important that you learn what I am saying. It's important that you get across the right message and you get across the right thing, right? So let me share the screen so everyone can see it. I'm constantly being interrupted by letting the participants enter. I'll make one of you, I think I'll make Dr. Asghar the admin, and he can then allow people to enter and remove them. Right. Okay. Now getting to the cases. Yeah. So we have ethics here. The first case is breaking bad news. Look at the task. It says Ali, 78, has collapsed and has been brought to the hospital with loss of consciousness by an ambulance. This is the information that the wife has because she's in the hospital. So that's the mutual information between you and the wife. If she's in the hospital, she's not here to give balloons and stuff. She knows she's here for her husband. Something has happened to her husband and he's in the hospital. So don't pretend like, Miss Maria, do you have any idea what has happened? Miss Maria, I'm here to talk about Ali. You're just creating more thrill. And BBN is not thrill. BBN is very calmly and very politely delivering the news to the patient, right? Patient's wife does not know anything about her husband's current condition. Current condition means what the team has decided and where he's going and how is he doing now. So she has no idea about that. She has no idea what the scans reveal, but she does know her husband is in the hospital. So you go inside. Am I talking to Miss Maria? Miss Maria, may I confirm how you related to Mr. Ali? And could you confirm his age for me? Miss Maria, I'm really, really sorry about Mr. Ali. I read about him that he's come to the hospital today, brought by an ambulance. You must be going through so much. Are you comfortable for us to talk about Mr. Ali? Because I'm here to give you some updates about his health at the moment. Okay. And then you start going through what she knows and then the rest of the structure. So that's a very different way of starting. Rather than going into the BBN, Miss Maria, confirm his age, his identity. So how can I help you? Then she tells you, I'm here to find out about my husband. You have already lost it when she tells you that I'm here to find out about my husband. Because imagine in a daily life, someone's here for breaking bad news and you walk in and you tell her, yeah, how can I help you? It's so awkward and it's so horrible to tell someone that because you know what you're going to say inside. Why are you asking her why she's here, what she's here for? You pretty much know what she's here for. 99% chances are she wants to know what's going on with her husband. 1% is she wants him to be dead. So regardless, make sure that you do it the right way, like you would have actually done it in your outpatient department, in your own clinical setup, in your own ward. You don't have to listen to the scripts. Don't listen to the scripts. Listen to your own intuition, listen to your own brain. Again, we have UNF2 in surgery. Mr. David, 65, had an ischemic stroke last night. Ischemic stroke last week, sorry, affected his left side. He was recovering well and doing fine. He developed another stroke yesterday and his GCS is 3 now. Now, he has been in the hospital for a week, this guy. He was recovering well. And then he suddenly collapsed again and now his GCS is 3. He has suddenly deteriorated on your ward. That's the information they're giving you. Then they did CT scan and it shows a massive clot in the brain. Only analgesics and IV fluids can be given to the patient. If patient deteriorates DNAR, his daughter came to discuss her father's condition. She is here to discuss her father's condition, which means she knows what's going on with the dad. Talk to the daughter, explain father's condition, address her concerns. Daughter is pregnant. Again, another clue for you to pay attention to. You have been informed that the daughter is pregnant. So don't pretend like she's not pregnant and you're asking, how are you doing? No, you know that the daughter is pregnant. MDT has decided surgery cannot be done and they have decided only palliative care is possible. So you walk in and you give a very good introduction. How you do that is, um, are you a daughter of Mr. David? Right. Could you confirm your name for me and his age for me? Okay. I'm really sorry about your father. I mean, he's been in the hospital for a week now. Must be very difficult for you as you're pregnant and you've been dealing with all of this. How is it affecting you? So start with asking about the pregnancy and her. Is she all right? Is she okay? I do realize. Then she'll reply to your answers, yeah, doctor, it's getting difficult. Oh, if you need any sort of help in the hospital, any help with, any rest place you need, just let us know. We're all here to help you, okay? And I do understand you're here to find out about your dad's condition. So I've been updated with all the things, and I'm going to talk about your father to you. So then you start with how much do you know? She might tell you she only knows about the first stroke. She doesn't know about the second stroke. She might tell you she just wants to know about the MDT decision. Do not start BBNing until and unless you hear how much she knows. That's very important. And I don't want to get into the details of the case because that will take more time. Today, we're just focusing on introduction. So, am I making sense so far? Do you guys understand where it's going?
Yes, thank you.
Let's go to another case. Joshua isn't coming in the exam, so we shouldn't really be worried about what's not coming in the exam. Post-operative bleeding vascular surgery. You are an F2 in vascular surgery. Mrs. Janet, age 65, has undergone an AF bypass surgery in the lower limb due to vascular insufficiency that caused calf pain. You are in vascular surgery. Janet had a surgery, so that's the information that is public. Everyone knows Janet has had a surgery of the leg due to insufficient blood. She was shifted to recovery room. After the operation, your nurse colleague noticed that she was bleeding heavily into the drain. A few hours after the operation, she was given 6 units of blood products. Your colleagues are all scrubbed in the theater. She was taken to the theater for re-exploration. Her husband has come to see the wife. Please talk to him about his wife's condition, current condition. What they mean by condition is not that your wife had a leg problem and then, she was in here for surgery. He already knows she was in here for surgery. There was no error in the surgery. That means you do not have to take the blame on yourself. The lady probably knew the complication. This is a known complication of the surgery. Consent from Ms. Brown has been taken to talk to the husband. So that also gives you the clue that you can very openly talk to the husband about anything that's happening. Again, this is a serious case. She has a surgery and there's a complication, and you can't walk in with energy and, oh, yeah, you must be so excited. He's happy because he thinks he's going to meet his wife and you're going to break the news. So you already need to get into form for what you're doing here. Okay. So you go inside. Are you Mr. Brown? Right. I believe you're Miss Janet's husband. Right. Could you confirm her age for me? Okay. Thank you so much. Mr. Brown, I do understand that Janet has gone under surgery today and she was here for that, right? Yeah. You guys had any conversations before the surgery? Did she say anything to you? All right. Okay. I'm actually here to update you on her condition, but before I dig in, do you have any questions for me before we start talking about it? So that's what you're going to do. You're not going to say, how can I help you? And he narrates the story that my wife had a surgery and I'm here to see her. She's not in the room. No, you already know that the wife had a surgery. You already know he's her husband. You already know he's here to talk about her. So don't let him talk about it. You talk about it instead. Okay. I'm not the admin. Dr. Asghar is the admin, so he should let in everyone because I'm not, I can only focus on one thing at the time. I can't focus on two, three things. We have postmortem, very interesting case again. Respiratory department, Mr. David, 60, was brought to the hospital because of cough 4 days ago. I was diagnosed with chest infection. He passed away yesterday. The wife knows he had an infection. You know he had an infection and he died yesterday. The most probable cause of death is respiratory failure due to chest infection. That's mutual information that you know and the wife knows as well. Please talk to Miss Sarah, Mr. Davis's wife. Postmortem has been considered to determine the cause of the death. Death certificate can be issued. Postmortem has been considered to determine the cause, but you don't need to talk about the postmortem till she asks you she wants to talk about it. Because see the task, it doesn't say she's here to talk about postmortem. She's not here for that. She might talk about anything else. She might have other questions that she needs you to address. But the mutual information here is that Mr. David came to the hospital 4 days ago and he died. And this lady is in immense stress because of the death of her husband. You walk in. I'm Aisha, one of the junior doctors here. I believe you're Miss Sarah. Um, could you confirm your relation with Mr. David for me and his age? Oh, Miss Sarah, my deepest condolences on his death. I mean, I have no words. Really very sorry about that. Um, are you holding well? Do you need any support? Have your friends and family been visiting you? Yeah, such a time, people should always be with someone. Staying alone can be very difficult. You can talk all of these things to build a good rapport. When you build a good rapport, you get all the good side on your table from the simulator. He's nice to you and he tries to help you. At the same time, the examiner knows you're different. You're not the journal public person who's coming and saying, so Miss Sarah, how can I help you? My husband died. I'm really sorry about your husband. Why does she have to tell you? You already know she's his wife and she's calling him to talk, and you already tell her, I'm really sorry, and you show concern for her. That is what will make you stand out from other people. Oh, who's the admin then? Oh, I am. I have no idea who the admin is at this point, and I have no idea how to let in others. Whoever is the admin, okay, I'll reclaim the host then. Oh, we have so many people waiting. Sorry. Okay. I'll replay this session as well. No big deal. I'll replay it because it's on recording as well. No worries. Okay. Domestic violence. Again, an interesting case. You are an F2 in OBS. Gynae, 12 weeks pregnant, Alicia, 28. Presented to the hospital complaining of PV bleed. She's here for her antenatal checkup. Your nurse examined her and found no visible bleeding in her vagina. Ultrasound shows viable 12-week pregnancy. Examination results were also normal. Your nurse colleague noticed a fingerprint-like bruise on her right wrist, but she did not disclose it to the patient. Talk to the patient, review the patient, do the necessary management, and address her concerns. Now, she's here for her antenatal checkup. Your nurse examined her and found no visible bleeding in the vagina. These are the things that you are supposed to tell her. Examination results were good. Everything is normal. The patient is safe. So you go inside. You Miss Alicia, you're 28, right? And I believe you're 12 weeks pregnant, right? Miss Alicia, are you all right at the moment? Because I was informed you had a PV bleed. Is the bleeding going on at the moment? Because you know there is nothing going on, but you're still cross-checking with the patient. Is the bleeding going on? Any uncomfort at the moment? Oh, okay. I'm actually here to talk about your results of examination and the tests we did. But before that, I'll just, get a brief idea of what exactly happened. I mean, can be very scary seeing yourself bleed and you're 12 weeks pregnant. Go ahead with these lines. Show her that I know it's a very concerning thing for you that you're bleeding at 12 weeks. I mean, it's a very scary thing to see. There's no harm in saying these things because these things make you stand out from the rest of the people. How can I help you? I am worried about my baby. No, you already know the information that she's complaining of PV bleeding. So you have the complaint on hand. Why are you pretending like you don't know? That's what makes you stand out from the rest of the people. Your first minute is your golden minute, and you need to have a different approach. Again, you are an F2 in medicine. Elena, 32, came to the hospital with insomnia. Talk to the patient and address concern. Now, this case, you know she has insomnia. Are you Elaine? Are you 32? Right. Thank you for the information. Oh, I've been told that you're struggling with sleep for some time. Oh dear, that must be such a difficult thing to deal with. How are you doing? Okay, right. Tell me a bit more about it. So, you're standing out from everyone else who says, how can I help you? What brought you in? These lines, these are old. You have to upgrade your game for the exam. You have to change the approaches. Then, again, an interesting case, cancer withhold. I'll do this and then we'll shift to a few cases from this PDF if we have any good information. So like you guys have an idea of the new cases as well. You're an F2 in surgery, Mrs. Maria, 78, presented to the hospital with confusion due to chest infection. CT was done and they found out bowel cancer, unfortunately. Your consultant decided to talk to the daughter to explain to her the condition. He has come to the hospital to talk to the consultant urgently. Muhammad, sorry. Your consultant decided to talk to the daughter instead to explain her mom's condition since the patient was confused. Her son, Mr. Ali, was not present at the time. He's come to the hospital to talk to the consultant urgently. Consultant is not available. He told a nurse he doesn't want his mom to know about her cancer. That's the mutual information. He has already told the nurse. Talk to Muhammad Ali and address his concerns. Consent has been taken from Mrs. Maria to talk to her son. Diagnosis is not yet given to the patient. Please, patient has been assessed and has full mental capacity right now. Okay, these are the mutual informations. Now, the mutual information is the mom has cancer, the son knows. The mutual information is also that he told the nurse he doesn't want anyone to tell his mom about cancer. So what you do is, you walk in. I'm Aisha, one of the junior doctors here in the surgery department. I confirm your name, Muhammad. Right, Muhammad, how are you related to Miss Maria? You're her son? Oh, can you just tell me one more thing, her age? Thank you so much. First of all, I'm very, very sorry about your mom's diagnosis. I mean, it's a catastrophe when it comes to these things and you're told. Yeah. How are you doing? How's family, with the news and everything? Right. Okay. I've also been informed by the nurse that you have certain concerns about your mother's diagnosis. You want us to tell her, am I right? Okay, I'll discuss that in detail with you. But first, I'll have to ask you some questions about your mom, and then you slide through it. So, this again is a different way of talking than telling him, how can I help you? So, you have to change. You really have to change the game because if you're walking in with how can I help you, you're going into the average category and you will only score a 657. That's your range. You will not go above it, you will not go below it. But if you really want to make a difference, you will have to creatively slide through the introduction. You will have to creatively slide through the stem that's been provided to you and what you can talk about and what you cannot talk about, because that is the only thing that will make you stand out. Otherwise, everyone falls into the same category. I hope I've made this clear so far. We have 9 minutes left. I'll take your questions in that. Any questions?
Thank you, Dr. Aisha.
Thank you.
Yeah, I want to ask, is this only applicable to ethics stations, or we can also use it for medicine or counseling stations as well?
Oh, it goes for medicine as well, because medicine section you'll be told she's here with a headache, she's here with a bad ache, with a bad backache, she's here for her multiple myeloma diagnosis. You have all of these things that you can talk about. So you will have information which you can paraphrase in every task. Even if it says they have concerns, you can still walk in and you can, like, 16-year-old has come out of appointment and she has concerns. You go inside. Well, Dr. Aisha, one of the junior doctors here. Are you Charlotte? Oh, Charlotte, usually 16 years old, are always with their parents. Are you all right? Has someone come in with you? Are you alone? Okay, how can I help you? So you're already targeting the fact that she's alone and she's just 16. It's a small child in front of you. So you can talk about it. You can paraphrase that in a different way. It's all on your brain. How do you paraphrase? How do you interpret all this information about pregnant ladies, mothers, fathers, the patient himself? How do you glide through these things? It's your own creativity, how you're going to come up with it. You're welcome, Dr. Server. My approaches are not different and they're not extraordinary. I'm just trying to open the cortex. Open the cortex. That's what I keep telling doctors. You don't have to be scared of the exam. This exam is extremely easy. And you only fail when you are stressed and you walk in and you're like frozen and just looking at the patient, that the patient is either going to abuse me, he's either going to hit me, he's going to say something. They're very friendly. They really try to push you through. And if you build a good repetition, if you build a good introduction, the first minute, you have two people on page. You have your examiner who's all ears to you because you made a very good introduction. And you have the simulator who's very happy with the fact that you actually cared about them, you read about them, and you remembered. And you didn't walk in asking them what's wrong with you. You came in walking that I know something is up with you and I'm here to help. So that really changes everything. I think a good introduction is the key to at least scoring 2 points above your usual average score that you're getting. You can get to a 9 and a 10 with a good with a good introduction. Simmons, I'm really bad at Simmons because I failed my own Simmons, so I don't think I'm good at Simmons. Yeah, you can say that I've been informed, I read from your notes. Oh, I had your notes outside and I was told that you weren't, sleeping well. Is something up with you? Is everything okay? Are you comfortable right now? Are you drowsy at the moment? You can ask that as well. You can throw any question, anything at all. It all depends on you how you make it. Dr. Siddhartha, the problem is that when I say something, it's gone. It doesn't come back to me. It's vanished. So I've recorded myself. And what I'll do is that I'll replay the recording. This session ends in 5 minutes. So we'll take a pause for 10 minutes and I'll replay the recording again. And those of you who have missed, they can hear it again. It's 40 minutes. The class will go on. Just join immediately when the same link, join it immediately and I'll let you in. And then you guys can hear all of it. Okay? Yeah, the point is be natural and act like our normal day-to-day consultation. Yeah. Dr. Shoke, we discussed that the other day. If you're not, see, that's another trick. You'll never finish your case sometimes, and you will finish your case sometimes. How do you deal with that effectively is that you address the concerns. So even if you have not gone through the 7 steps, you have addressed the concerns rightly, and you're different from the rest. Now, about results. Let's say we have a case of Barrett's esophagus is here for results. You go in. I'm Aisha, one of the junior doctors here at the GP surgery. Am I talking to John? Yeah, John, could you confirm your age for me? Right, John. So I've been handed over your results and I believe you got a camera test done, right? Yeah, I have your results here and I'm here to discuss those with you. But before that, obviously, I'll be asking you some questions to make sure the results make sense to you. Are you with me? Okay, so, and then glide through the questions. So that's how you can do. Then again, a patient who's getting discharged and they have some concerns. I am Aisha, one of the junior doctors here in the medicine ward. Are you I'm thinking of all my female nurses and male nurses. And are you Carl? Right, Carl. So you must be really happy. Today is a big day. You're going home. How are you feeling about it? Is someone here? Someone's coming up to pick you, or you going yourself? Right. Okay. And how was your hospital stay? Was it good? Oh, I'm glad. I'm glad. So I've been told that you have some questions for me today. I'm more than happy to address all of them for you. Could you tell me um, what questions do you have, and then ask the questions, and then start collecting data, and then go to the section where you're addressing the concerns. And also you can always go through that, you can always do that in missed mi. Again, Mr. Ali, I'm really really sorry. I read from your notes you've come in with a heart attack. Oh dear, must have gone through tremendous pain. How are you doing now? You're doing well. How was your hospital stay? Oh, I'm more than happy that you're good. And then you glide through other things and you keep going in. So, introduction. I am giving you my word and I'm swearing on it that introduction upgrades your score at least 2 points. It's that important. And it's something doable. It's not like you freeze when you go, it's something very doable. Respiratory examination is not coming in the exam. You're getting ECG, you're getting per speculum, you're getting venipuncture or maybe cannula insertion, and those are very easy. I had it in my exam and I finished it in like 7 minutes probably. We didn't have, we then spoke about how his med school is and what he's learning and stuff. So just be yourself, be very natural and be yourself. That will make a difference. And if yourself is an introvert, then don't be yourself. Then be someone who you know is very good at talking, and someone who's an extrovert and who's really engaging with patients, then try to be like them. So I know people have different personalities, but for this exam, you need to have a very, lovey-dovey and very social and very happy sort of a person. That's who you're supposed to be, unfortunately. I think ladies are fine with it, but men have a struggle. They really, really have a struggle with that. So sorry about that. You guys will have to turn to girls for the exam or whatever. Okay, I'm ending this session. I hope it was fruitful and I got the message conveyed. I'll replay it at say 4:15. So all of you can join then. I'll post the link again in the groups and see you then. Bye-bye. Take care. Allah Hafiz.